And at this time, I would also like to introduce Dr. Brian Patel. He's the Associate Chief of the Emergency Care Center, and he's going to say a few words for us.
Good morning. So I was asked basically to come and say a few words given the current climate with infectious disease and the prevalence of concern for Ebola virus disease. We thought it might be prudent to just spend a few minutes talking about the disease and provide some more information to the community about what the disease is, its transmission, sort of give people an idea of some more information about it. I don't have any fancy slides. This is just going to be a brief sort of overview. I know we kind of went from a situation where there wasn't very much information about the disease to a situation where you're almost on information overload. You get things sent to you via email, on the internet, every day with all different kind of things about the disease. So just as a quick overview, Ebola virus disease used to be called Ebola hemorrhagic fever. First outbreaks were in Africa, started in 1976. So it's actually been a virus that's been around for many, many years, but in general has not caused a lot of problems because of the location of where the virus is. The outbreaks that have occurred in the last 40 years tend to occur in very remote areas of Africa where there isn't travel into and out of those communities, so it tended to self-contain itself and not spread out of that. This last outbreak is a little bit different because it ended up spreading into more metropolitan areas of West Africa, such as Monrovia, which is one of the big cities in Liberia. And then because of the situation in West Africa, it led to a much bigger outbreak. So why do you have thousands of people dying in Africa and you don't have the same thing in the United States? The biggest reason is resources. So their healthcare system is much more poorly developed than ours. They don't have the resources to have the appropriate PPE or personal protective equipment to protect themselves from the virus, which in the United States we have the benefit of having that throughout the country. They have different cultural practices that we don't have. So their practices of burial of human remains is very hands-on. It involves a lot of contact with different people, and the virus does remain alive in the remains of bodies for several days, which is why that also contributed to spread. And then just a lack of education. How do you get that information out to remote areas of Africa or to parts of Africa where there may not be TV, there may not be internet or anything like that for people to understand, the importance of what's going on. And then also, if you think about it, the transport. So a lot of people in Africa, they don't have access to healthcare, so what do? They take care of their family members in their own homes. So these people are, dying in their homes with Ebola virus disease and just spreading the virus everywhere, and people don't really know what to do to prevent it. All of those things in general don't occur in the United States, which is why even with the 3 cases that occurred in Texas, it's managed to self-contain itself because there's been so much awareness, there's been so much involvement with the CDC and the government in terms of quarantining, self-monitoring, and things like that to prevent spread of the disease. The disease itself is spread only by contact. So you have to have direct contact with someone that has Ebola virus disease and be in contact with their bodily fluids, whether it be saliva, sweat, vomit, diarrhea, semen, things like that. But it has to directly contact you and then get into you. So it has to be through a break in your skin or through a mucous membrane through the eyes, nose, or mouth. So the idea with the personal protective equipment we use is that it completely covers you from head to toe so that you have no exposed skin to minimize exposure to the disease. A couple of the concerns that occurred with what happened in Texas with the 2 nurses that contracted the disease was protocols in putting on and taking off the PPE. Now, putting on the PPE is not that hard. It's already clean. There's not a lot of concern. It's more in taking it off. You have to know how to take it off properly so that as you're taking it off, whatever fluids may be on the gown and gloves doesn't get onto your skin. From what I understand, the 2 nurses there most likely contracted the disease toward the end of this patient's disease process, where that's the time where you have the most copious bodily secretions. You have significant vomiting and diarrhea, you have significant diaphoresis or sweating from the fevers. You can get bleeding from the disease as well. And so all of that puts you at much higher risk for contact. And I think given the unfortunate incidents of what happened with that, the country in general is much more prepared. We're going through training processes in all the hospitals in the country, including Sturdy, to make sure that everyone knows appropriately how to take on and take off personal protective equipment. In terms of the community, you can't get Ebola from water, air, or food. So you're not going to get it by eating something that someone else ate. You're not going to get it by being in the same room with someone. You have to be in close contact, which they define as being closer than 3 feet for a prolonged period of time. and have contact with their bodily fluids. If someone with Ebola virus disease sneezes or coughs and those secretions come out and hit you directly on the face and get into your mucous membranes, yes, you can get it. But it's not like the flu where it kind of hangs out in air for a period of time that you can then inhale. It doesn't last that long outside of the body. So you really have to be very, very close. And again, the risk in Massachusetts is almost zero because you can't get it unless someone has it. And the only way someone is going to have it is if they've traveled to West Africa and been in contact with someone who's had Ebola virus disease. So it's a very, very difficult disease to get. And while it is the prevalent disease that we're talking about right now, because of obviously the concerns with the high mortality and everything that's going on, we're also entering influenza season. And influenza is a much more concerning disease in the United States from my perspective. It kills many more people than Ebola virus disease ever will. And I think, unfortunately, in talking about it, we've kind of lost sight of, or the media has lost sight of the importance of promoting flu vaccination and hygiene for preventing influenza during the season. So that's my public service announcement for the flu. And at Sturdy, we've continued to sort of address that issue in terms of the flu as well. So that's basically it. Do you guys have any questions at all about Ebola?
Brian, how much training are we doing here at the hospital?
So we're training all essential personnel that'll have immediate contact with the patient in fully in how to take on and take off PPE. We have plans in place that we're starting to educate staff about as well, or have educated staff about as well in terms of how to handle a patient should they present to our emergency department. So we've made everyone aware.